And now I'm going to be showing you the Hughston method of how to obtain a tangential patella. This view is very beneficial for when you have patients with large knee effusions. They tend to settle posterior on the patient, and so they're unable to fully flex their knee. So whenever you have that happen, typically on the Setagast method, we were at a 45. Well, this patient is only really able to get about 60 degrees or so. So you see that you have a much larger angle to account for here. And again, routinely you'd have your patients with no shoes on, pants off, they'd be in a gown, that sort of thing. So that way you don't get any obscurement of your image. So with this patient, again, you have this 60-degree angle here, and we are going to be centered up just like before. And the tube itself is going to be at about a 45-degree angle, which is what I'm about at right now. And another technique to also look at is to make sure that your collimator, the light, is all aligned appropriately to the patient. A lot of times they'll be obscured and angled more to one side versus the other. So make sure you line up your tube coming behind it, making sure that it's nice and straight and in alignment with our patient. So this is really, really important, okay? That way you don't get foreshortening or elongation of any of your images, okay? So if your patient that you notice that they're kind of starting to roll medially or whatnot, or even externally or laterally, make sure you realign them appropriately again. And then also if they're unable to hold that, what you can do is get a sheet or bands or something. Can you bring your arms down for me? And what you can do, remember your patient can't bring their leg up that far, is wrap a blanket on them and bring your hands more immediately up towards your back if you can. There's that one there, that one there. Bring this leg back down, 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 down. Good, and so this is gonna help stabilize the legs so you don't have that sort of drift that might happen with your patients. And again, make sure that you are at 40 and we are shy. So we are gonna come back out. So there we go, 40. And once again, I'm gonna make sure that I am straight to the patient. There we go. You're going to make sure that you are feeling the apex of that patella and going 1/2 inch distal to that. So superior to that. There we go. You're going to collimate down as to not too tight to where you're going to miss any sort of pertinent anatomy. Also makes it so that you get any of this other obscurement from shoestrings, the towel, or the patient's pants out of the way as well. And then what we're going to do is put your marker right on the outside, whoop, just like that. And remember not to get it too close, whoop, into the anatomy of interest, but you do want it relatively close there. Okay? And that is the Hughston method.